during the voiding or during urination?
Very painful, almost to the point of tears.
And that was every time. So you're talking about 45 times a day and night that you had to go to the bathroom. It was painful.
Yeah, it was agony.
It was agony. And you started the protocol, and now you've had relief of various symptoms. So number one, from having the pain with the urination. Are you having any pain with urination?
No, that's gone.
That's gone.
Yeah.
100%.
Yeah.
And how long has it been gone for?
About a month.
A month.
Yeah, exactly, but the headaches were monthly, and I don't have them now. Zero.
And it's been, I think. Hello, if you are one of the many millions of people around the United States and even around the world who are suffering with a chronic interstitial cystitis condition and or an overactive bladder condition, you deserve to listen. You deserve to discover that there is a way that you can actually finally get yourself fixed. My name is Dr. Lonnie Herman, and I'm with a patient. This is
Jerry Llewellyn.
Excellent. And my clinic is down in South Florida, and you came here from
Arkansas.
Yes, excellent. So, Mr. Llewellyn, you had, first of all, we're reporting that you've had some great decrease in your symptoms over here.
Yes, I'd say at least it's half as bad as it used to be.
Half as bad. And that was only one treatment that we've had so far.
Correct.
Yeah. And you were diagnosed with interstitial cystitis?
Yes, sir.
And how long ago were you diagnosed with that interstitial cystitis condition?
It's been about 4 years.
4 years. And before those 4 years ago, were you functioning normally with the bladder?
Absolutely normal, yes.
Normal, no pain?
No pain.
No pain, no urgency, no frequency?
Nothing.
Right. And so did all of it start immediately?
Yes.
I mean, and all of it at once? You had the pain start, the urgency, the frequency all started at the same time?
It progressively got worse.
And progressively got worse. So one of your symptoms was your urgency. You felt the urge to go to the bathroom, and you had to go to the bathroom with that urge. The frequency and the urgency was how many times in a 24-hour period?
Oh, maybe 30, 40 times.
30, 40 times. Well, 30, 40 of what you originally told me, we'll say. In your daytime, you originally told me it was 30 times plus.
Yeah.
The day, and at nighttime, it was about 15 plus.
Right.
So you're probably about, let's say, 45 plus times in 24 hours.
It was a lot. That's about all I did was just go to the bathroom.
And when you went to the bathroom, were you able to hold the bladder until you got to the bathroom? Was there any leakage that was happening then?
Not really leakage, but there was pain if I didn't go immediately.
And the pain was in the bladder
Yes,
area.
sir. Yes.
And then did you have pain during the voiding or during urination?
Very painful, almost to the point of tears.
And that was every time. So you're talking about 45 times a day and
Mhm.
night that you had to go to the bathroom. It was painful.
Yeah, it was agony.
It was agony. And you really couldn't control that. You couldn't
No.
control the pain, and you couldn't control the frequency or the urgency prior to coming here.
Correct.
Yeah. And one of the other issues, one of the other symptoms you have with your interstitial cystitis condition was that you had a weak flow.
Right.
Right. And now after your first treatment, your first protocol, after your first exam, which you came to me, just to be clear, this is May 6th of 2019, and your first examination was November 6th. We're talking 4 months ago. Exactly, on the day, 4 months ago, you came to my clinic, we did that first exam, sent you the protocol, and you started the protocol, and now you've had relief of various symptoms. So number one, from having the pain with the urination, are you having any pain with urination?
No, that's gone.
That's gone.
Yeah.
100%.
Yeah.
And how long has it been gone for?
About a month.
A month.
Yeah.
And was there any medication that you've taken prior, any antibiotics? Were there any kinds of herbal pills, any other kinds of pills that actually ever took away completely and for a sustained period of time, anything that ever took away the pain during urination?
No, nothing.
The agony was constant.
I've tried a lot of things, dude.
A lot of things. And both medical and alternative.
Correct.
Yeah. And you had been to what kind of doctors who diagnosed this and actually maybe others who you went to investigate for this condition?
Well, I've been to urologists, about 6 or 7 different just regular doctors, and then functional doctors, which and it was just costly, and nothing really helped. So
Until now.
until now,
Yeah.
yeah.
And so with those urologists, they did cystoscopes,
Yes.
cystoscopies.
Yes,
and
very
other-
painful procedure.
And what other tests did they do? Urine?
Oh yeah, they always took urine tests and found nothing.
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 Couldn't even tell. And they said maybe you had a thick bladder or just an irritated
Yeah.
bladder was about it.
Right. That's about all they came up with.
You also said that you had the flare-ups that you were experiencing. How often were the flare-ups? Was that every day and multiple times throughout the day, the flare-ups?
No, that was more like once a month, and it would last for 3 to 4 days, maybe a week sometimes, which was very painful. And I would get spasms at night during those flare-ups.
And now what's the difference with regards to that flare-up and the spasms at night?
I would say it's been cut in half.
Okay. And you had headaches for how long prior to starting with me?
I can't remember exactly, but the headaches were monthly, and I don't have them now.
Zero.
Zero.
And it's been, I think you told me before, there were about, how long have you been? 2 months with no headaches?
Yeah.
Yeah, 2 months. And you also said, so getting back to the urgency and the frequency and the pain with this bladder control problem, you said that you were getting up, it was about, at night, it was about 15 times, give or
Right.
take, maybe another 1 or 2 times at night.
Mhm.
And so that was every 30 minutes when you were sleeping, you
Yeah.
had to go to the bathroom.
So there wasn't much sleep.
There was no sleep. And you also had about 30 times plus in the day,
Right.
and that was also about every half hour going to the bathroom.
Yeah.
Yeah. And so now you're at night, what you reported is that you're going maybe 1.5 hours to 2 hours without
Right.
feeling the urge to go.
Right.
And again, with that urge, there is no pain during the voiding.
Right.
And in the daytime, you're only going maybe once every 2 hours
Mm-hmm.
instead of every 30 minutes. And no pain in voiding.
Right.
We're pretty satisfied with this.
I'm feeling much better.
Excellent, excellent. So in this next round, we're looking to clear up, hopefully it's going to clear up the rest of what's causing the remainder of the frequency, because you really should be able to sleep all night through the night with 0 time in the bathroom. Even if you drank a glass or a cup or so of water before going to bed, you really shouldn't have to get up during the night. So when we have great bladder control, you might have to wait till, maybe more towards the end of a 7 or 8 hour sleep period before you have to get up, but you really should be able to make it through the entire nighttime without feeling the urge to go to the bathroom or the full bladder. All
Back
right?
to normal.
Yeah,
That'd
and
be
that's-
nice. I
that's
can't
the goal.
wait.
It's coming, it's coming, it's coming. So, but at least we can say this, that in 4 years of suffering and 4 years of different treatments, nothing brought you to this point.
Correct.
Besides this part.
Besides this,
Yeah.
right.
So we're pretty satisfied, and it's a great reduction in his interstitial cystitis symptoms. The urgency is decreased, the frequency is decreased, the pain during voiding is completely gone, and the headaches are completely gone, and his flare-ups have greatly reduced, and so we're pretty satisfied. So hopefully to be able to check back in with him either in person or with a long-distance Skype or computer video style interview to be able to see when he's completely recovered and share that with you as well. Stay tuned. I will be transferring or moving into another video where I'm describing the kind of exam findings that I've discovered with him, and then help you understand more about what this treatment is that brought him to this point, and we'll bring him to the next stage of having complete recovery. Okay?
Thank you, Dr. Herman.
You're welcome. Thank you.